Hello viewers, welcome back to my channel. In today's video, we are going to talk about the SDTM physical examination domain, one that often raises questions about when and how it should be collected. We will look for the purposes of the physical examination domain, what information it captures, and the different scenarios defined in the SDTM and CDISC guidelines, including when the physical examination data go into other domains like MH, AE, or PR. So let's get started and understand how to handle the physical examination the right way. Now let's look at the purpose of the physical examination domain. The PE domain is used to capture the findings of the physical examinations that are recorded by the investigator during the study. These findings are typically collected on the CRF as part of screening, baseline, or follow-up visits, and they tell us whether any abnormalities were observed during the examination. The domain records results for various body systems such as the head, eye, ear, lungs, heart, abdomen, or skin. Each of these is represented as a separate record in the physical examination dataset along with its outcome. For example, whether it was the result was normal, abnormal, or the test was not done. So in short, the physical examination domain helps us capture what was examined and what was observed for each body system, providing a structured record of the subject's physical health throughout the system study. One might have a confusion that what is the difference between the physical examination and the vital signs. The physical examination domain captures the investigator's finding from a hands-on physical assessment of the subject, whereas the vital signs domain specifically records the measurable psychological parameters like the blood pressure, heart rate, temperature, and the respiratory rate. For further detailed difference between the vital signs and the physical examination domain, I will suggest you to watch my video on the vital signs domain. As per the SDTM IG version 3.4, there are two different scenarios in which the physical examination can be collected. So now let's understand the scenario 1, which is also categorized as the best practice in collecting the physical examination. In this slide, what we will see is we will see how the physical examination is captured on the CRF and how it is mapped to the SDTM domain. So now let's look at the CRF completion instructions. It says that if the physical finding or abnormality started before the study defined start period, or for example, before the subject received the first dose, it should appear and should be recorded in the medical history form. But if the physical findings appear after that time point, that is after the baseline, then it should be considered as the adverse event and should be recorded in the AE form. So in simple terms, the examination which we do at the screening level, any abnormalities found at that time should be captured as a medical history and not as a physical examination. And all the findings which we have after the baseline, that is in the post baseline period, then all those findings should be recorded in your adverse event domain and not in the physical examination domain. So in the first scenario, you will see that it will favor the creation of the medical history form as well as the adverse event form instead of the physical examination form. So according to this scenario, the best practice approach, we may keep the physical examination CRF very simple. So what we are capturing in this form is whether or not the examination was performed and the date of examination. And you might also see here that the information which we are capturing is populated in your PR domain instead of the PE domain. So again, this is one of the changes which we have observed in the SDTM IG version 3.1, 3.4 from the previous version, that if you are following the scenario 1 in your study, in that case, you will not be creating the physical examination domain, but instead, if you are having the CRF form like this, that was the physical examination was performed, the response of it, whether it is yes or no, it will go in your PR domain, and the reason for not being performed will again be populated in one of the subcall variables in your PR domain, where the label will be reason for occur value, which is occur is the physical examination was performed or yes or no, and the date on which this assessment was done or not done, that is the CRF form was captured, that date will be populated in your PR STDTC. And all the findings, which if the examination was performed, all the findings which is done for the baseline visit will be mapped to MH domain, and all the post baseline observation will be captured in your AE domain. So in this scenario, you will not have a physical examination domain in your data set. Now let's see the scenario 2 and 3, which represents the traditional way of collecting physical exam data. In scenario 2, the physical exam CRF is used to collect the data for both baseline as well as post-baseline visits. That means the investigator records the physical examination results at screening as well as again at the subsequent visits during the study. However, in scenario 3, the physical exam CRF is used only at baseline, and during the post-baseline visits, if any observation is captured, that abnormality or the baseline condition worsens scenario will be captured in your adverse event form and not in your PE form. Now, according to the CDISC implementation guide assumptions, when sponsors choose to use a traditional PECRF questions, that is, whether the exam was done or not, in that case, we will capture that information in your in the scenario 2 and 3. That question will be captured in your PSTAT, whether it is if the response is no, then it will be not done, otherwise we will have the PSTAT as null and will capture the rest of the information. But if this same question is being asked in your scenario 1, then this information will go to your PR domain, that is the procedure domain, and not in your PE domain. So while we are discussing the scenario 2 and 3, we should keep in mind the difference between the scenario 2 and 3 along with the scenario 1. So talking about the scenario 2 and 3 here, if the response to the question, the first question was the physical examination performed is yes, then we will have the exam date, and we can also see in some study, depending on the sponsor's requirement, if the sponsor chooses to keep the category of the physical examination question as a hidden question or a non-hidden question, then we will have the PCAT also. Otherwise, we might not have this information question asked in the CRF form. It all depends on the discretion of sponsor. So we have, you can see in this form, which is the CDISC defined CRF form, which can be used for the scenario 2 and 3 here, that we can also have a question where the sponsor may insert instructions to ensure each record has a unique identifier. So if that is added then or added or collected on CRF form, then we will have that information mapped to the PE SPID here. Now comes the main questions about the physical examination. What was the body system examined? So that information is your PE test and PE test CD. The result of this examination, whether it was normal, abnormal, or it was not done, is captured in your ORRES here. And if the result is abnormal, the findings, or you can say the abnormality, will go in your ORRES variable. And if these findings are abnormalities are encoded, then the standard values for these encodation will go in your stress C variable in your PE domain. We also have questions for the physical examination result being clinically significant, yes or no. So that will go in your subqual, which is the clinically significant subqual here. We also have questions about capturing the evaluator who has done the evaluation or the physical exam in your PE event. We have the reason the data was not collected here. If the response to this is not done, then what was the reason it was not done? We can have that reason captured in your PE reason variable. We have the BOTSIS or the organ system information being captured as well, and along with that the additional information about the anatomical location, the side of the anatomical location, and the directionality of the anatomical location. All these questions can be added in your CRF form, and we can map this in respective SDTM variable, which is PELOC, PELAT, or PEDIR. Then we can also have a question about the method used for the test which is being conducted. So that will go in your PE method. So this is the CRF form traditionally used for scenario 2 and 3. But again, please make sure you understand that if you are using the scenario 3, then this form will be used only for the baseline assessments, because in scenario 3, all the post baseline assessment will go in your AE domain. That is, if there is any abnormalities found in your post baselines, or if there is any worsening happening from the assessments done at the baseline visits in the post baseline visits, then those changes or the worsening conditions will be captured in your AE domain in your scenario 3. Scenario 2 is the only scenario where you will capture all the information, whether it is baseline or post baseline assessments in this PE domain. Also note that whatever abnormalities you are finding, whether if it is in the baseline visits, then all those abnormalities will also be mapped to your MH domain and be categorized as the medical history recorded at this baseline visits. And all the abnormalities found at the post baseline will be captured in your AE domain, irrespective whether you are following the scenario 1, 2, or 3. So if we see if we are following the scenario 2, then the information which we are capturing in PE domain is also being captured in your MH and AE domain in one way or the other. Let's take a quick look at how the physical exam or the PE domain has evolved across the SDTM version from version 3.1.2 to version 3.4. In version 3.1.2, the physical exam domain was the main place to record physical exam findings. Things like whether the heart, lung, or abdomen were normal or abnormal, these were collected. We used variables such as the PEORRES, PELOC, and PE method to describe what changed and where and how. Moving to the version 3.2, the structure of the PE domain didn't really change, but the guide added more clarity on how to use it correctly. It explained better how to define the key variables and how to describe the exam results. Then came the version 3.3, which introduced several body system specific domains like the cardiovascular, nervous, and ophthalmologic. That meant that some of the exams that were earlier went to the PE domain could now be placed into these new, more specific domains. For example, an eye exam earlier would go in your PE domain will now be mapped to your OE domain, which is the ophthalmological domain instead of the PE domain. Finally, in version 3.4, CDISC gave even clear guidance. They said if the physical exam data are collected using a prompt question style CRF, that is the abdomen normal, those should be mapped to the PR domain or to the body system specific domains. If in many newer studies which are designed on the CDISC standard, the latest standards, you might not even see PE dataset at all. That's all for today. If you find this video helpful, don't forget to like, share, and subscribe for more content on SDTM domains, ADAM, and clinical SAS programming. Comment below if you want us to cover a specific domain or topic next. Thanks for watching.